In this video, we're going to cover the objection when a patient says, I'm too old to do the treatment, or ask you, is that worth even doing at my age? I hear this excuse a lot in Florida. I have a lot of seniors that come in. A lot of them think they have one foot in the grave and it's not worth doing anything at this point in their life. So it's really important. So when they ask me that, well, I'm too old, or is it worth it at my age? My response is, I don't know. How long are you going to be around? Of course, they all laugh, but it does make a point that we really don't know. And I'll explain to them that, think about this for a minute. I'll say, if you don't do the work that you need because you think you're too old, and then you end up living longer than you think, you're really going to be in bad shape. And things may have gotten so bad that you may not have any option except to pull everything out. Is that what you really want? And of course, they don't, and they'll tell you that. You can ask them, let me ask you this. How well do you think you would do with dentures? If they have their own teeth and they need to be fixed up. And so a lot of them will say, well, not so good. Say, well, the problem is if we don't fix your teeth up and you have to lose them, then we're going to have to make you dentures if you want something to chew with. So how well do you think you would tolerate those at this point in your life? And of course, they say, probably not too good. I remind them that the only people that do really well with dentures are people that have had them for a long time. So I'll ask them, do you really want to spend your remaining years trying to get used to talking and eating with a set of dentures and have to take them in and out at night? And of course, none of them want to do that. So I'll tell them that I have seen many patients in the nursing home, and a lot of them have shared with me. They'll say, Dr. Matheny, if I knew I was going to live this long, I would have taken better care of myself. You see, a lot of them thought they were too old, know they needed some dental work done, but they figured they weren't going to live much longer. Next thing you know, they live 5, 7, sometimes even 10 years longer than they thought. And now everything is broken off to the gum line, hurting them. They call me in and say, you got to fix this person's teeth. I say, the only thing I can do is take them out and make dentures. There's nothing worth saving. So we take them out, put dentures in, they wear them about 3 days, throw them in the drawer and say, heck with it, I'll just gum it. Because they just don't have the patience or the tolerance to get used to them at that point. So I share that story to really make them think. So a point to remember is you're never too old to look good and get healthier. During your older years, you want to make sure your remaining time you don't have pain and you don't have infection, because that puts a heck of a strain on your immune system. And it's harder for you to fight off illnesses and diseases as you get older. So being pain-free and infection-free by keeping your mouth healthy has a lot of great benefits at any age. Finally, you can show them pictures or let them read testimonials of somebody in their 80s or 90s that went ahead and got their work done, and how happy they are afterwards, how great their mouth feels, how good they can chew, how good they look, how they look more youthful and younger. And it makes them realize that there's other people are doing it and they're happy with it. And it helps them make that decision to have that work done also. So the point is, just really stress that because we don't know how long we're going to be around, it's worth going ahead. It's always better I always say it's better to prepare for the worst and assume the best. So we're going to assume they're going to be around, and I tell patients whether I'm 80, 90, or 100, if I need something done, I'm going to do it because I don't know how long I'm going to be around, and I want my remaining years to be as pain-free and comfortable as possible. So use these responses when your patients think they're too old, and you'll get a lot more of them to realize that it makes sense to go ahead and do it. So this concludes this video, and it also concludes this module. So congratulations on completing Module 4. This is awesome. I'm really proud that you have stuck with it this far, and you have persevered, and you have continued on this course with me towards sales mastery. So go ahead and go on to the next module, and we'll see you there.